Snoring, causes and when to see a doctor. Snoring is the harsh sound that occurs when air flows past relaxed tissues in your throat, causing the tissues to vibrate as you breathe. Nearly everyone snores now and then, but for some people it can be a chronic problem. Sometimes it may also indicate a serious health condition. In addition, snoring can be a nuisance to your partner. Lifestyle changes such as losing weight, avoiding alcohol close to bedtime, or sleeping on your side can help stop snoring. In addition, medical devices and surgery are available that may reduce disruptive snoring. However, these are not suitable or necessary for everyone who snores. Symptoms. Snoring is often associated with a sleep disorder called obstructive sleep apnea. Not all snorers have obstructive sleep apnea, but if snoring is accompanied by any of the following symptoms, it may be an indication to see a doctor for further evaluation for obstructive sleep apnea. Witnessed breathing pauses during sleep, excessive daytime sleepiness, difficulty concentrating, morning headaches, sore throat upon awakening, restless sleep, gasping or choking at night, high blood pressure, chest pain at night. Your snoring is so loud, it's disrupting your partner's sleep. In children, poor attention span, behavioral issues, or poor performance in school. Obstructive sleep apnea often is characterized by loud snoring followed by periods of silence when breathing stops or nearly stops. Eventually, this reduction or pause in breathing may signal you to wake up, and you may awaken with a loud snort or gasping sound. You may sleep lightly due to disrupted sleep. This pattern of breathing pauses may be repeated many times during the night. People with obstructive sleep apnea usually experience periods when breathing slows or stops at least 5 times during every hour of sleep. Causes. Snoring can be caused by a number of factors, such as the anatomy of your mouth and sinuses, alcohol consumption, allergies, a cold, and your weight. When you doze off and progress from a light sleep to a deep sleep, the muscles in the roof of your mouth or soft palate, tongue, and throat relax. The tissues in your throat can relax enough that they partially block your airway and vibrate. The more narrowed your airway, the more forceful the airflow becomes. This increases tissue vibration, which causes your snoring to grow louder. The following conditions can affect the airway and cause snoring. Your mouth anatomy. Having a low, thick, soft palate can narrow your airway. People who are overweight may have extra tissues in the back of their throats that may narrow their airways. Likewise, if the triangular piece of tissue hanging from the soft palate is elongated, airflow can be obstructed and vibration increased. Alcohol consumption. Snoring can also be brought on by consuming too much alcohol before bedtime, Alcohol relaxes throat muscles and decreases your natural defenses against airway obstruction. Nasal problems. Chronic nasal congestion or a crooked partition between your nostrils, deviated nasal septum, may contribute to your snoring. Sleep deprivation. Not getting enough sleep can lead to further throat relaxation. Sleep position. Snoring is typically most frequent and loudest when sleeping on the back, as gravity's effect on the throat narrows the airway. When to see a doctor. See your doctor if you have any of the above symptoms. This may indicate your snoring is associated with obstructive sleep apnea. If your child snores, ask your pediatrician about it. Children can have obstructive sleep apnea too. Nose and throat problems such as enlarged tonsils and obesity often can narrow a child's airway, which can lead to your child developing obstructive sleep apnea. Complications. Habitual snoring may be more than just a nuisance. Aside from disrupting a bed partner's sleep, if snoring is associated with obstructive sleep apnea, you may be at risk for other complications including daytime sleepiness, frequent frustration or anger, difficulty concentrating, a greater risk of high blood pressure, heart conditions and stroke, an increased risk of behavior problems such as aggression or learning problems in children with obstructive sleep apnea, an increased risk of motor vehicle accidents due to lack of sleep,